Stop scrolling. If you see one of these signs, you might need to act fast. In this video, I'll show you 15 early warning signs most people overlook, and I'll tell you exactly when to see a doctor. Where are you watching from? Drop your country in the comments now, I'll read them later. Ready? Let's go. Sign number 1, unexplained weight loss. Losing weight is usually seen as good, but unintentional loss of more than 5% of your body weight in 6 to 12 months without trying is a red flag. It may signal conditions such as thyroid disease, diabetes, cancer, chronic infection, or depression. If you're not dieting and you're eating normally or more, but the scale keeps dropping, book a checkup. Your doctor will ask about diet, bowel habits, appetite, medications, and order tests like blood work, thyroid tests, or imaging if needed. Quick check, type yes if you've lost weight without trying in the last 6 months. If so, how much? Put the number in the comments, I'll reply to some. Sign number 2, shortness of breath, especially if it comes on suddenly or is out of proportion to activity. While mild breathlessness after climbing stairs is normal, sudden or progressive breathlessness can be caused by anxiety, low oxygen, poor circulation, heart strain, and they are indication for asthma, pneumonia, heart failure, pulmonary embolism, or serious anemia. If you feel breathless at rest, or your lips or fingertips turn blue, call emergency services. If it's progressive and happening with fatigue and swelling in the legs, bring it up with your doctor, it could be a heart or lung issue. If you've ever felt sudden breathlessness, write a one-word description of how it felt. Sign number 3, chest discomfort. Don't ignore pressure, squeezing, or pain in your chest, especially when paired with shortness of breath, sweating, nausea, or faintness. These can be signs of a heart attack. Note, heart attack symptoms can feel different in women, older adults, or people with diabetes, sometimes as jaw pain, indigestion, or sudden fatigue. If someone looks pale, sweaty, confused, or faint, call emergency services right away. If you have nitroglycerin for known angina, follow your doctor's plan. Don't wait. Hit the like button if you know CPR basics. We'll make a CPR guide next month if enough of you want it. Sign number 4, new or persistent changes in bowel or bladder habits. Healthy bowel movement is once or twice daily. If you're always constipated, or rushing to the toilet multiple times, your digestive system is imbalanced. Constipation, diarrhea lasting more than 2 weeks, blood in stool, or new urgency and frequency. These could signal colorectal cancer, inflammatory bowel disease, infection, or other bowel conditions. For bladder issues, blood in urine or difficulty urinating, think urinary tract or even prostate issues in men. If you notice bright red blood or black tarry stools, seek medical attention quickly. Don't assume it's hemorrhoids. Drink warm water. Eat papaya, oats, beans, and vegetables. Take a short walk after meals. Tell us, have you ever delayed a checkup because of embarrassment? Type yes if you have. Let's normalize getting checked. Sign number 5, persistent fatigue that doesn't improve with rest. Everyone gets tired, but if you always wake up tired, even after sleeping, your body is not getting enough oxygen or nutrients. When fatigue becomes normal or interferes with life, something is already wrong inside your body. This may be a sign of low iron or anemia, thyroid imbalance, chronic stress, poor gut health, depression, sleep apnea, infection, vitamin D deficiency. If you're sleeping 8 to 9 hours and still exhausted, that's a problem. Eat iron-rich foods like spinach, beans, oats, eggs. Get early morning sunlight. Reduce late-night eating. And drink more water. Keep a sleep and energy diary for a week. Note when you sleep and how you feel through the day. That's useful for your doctor. On a scale of 1 to 10, how tired are you right now? Put the number in the comments. Sign number 6, new or changing mole/skin lesion. Your skin is the mirror of your internal health. If you notice dark patches, sudden acne, itchy rashes, dry, peeling skin, it may be related to high blood sugar, stress, hormonal changes, dehydration, vitamin deficiency. Never ignore fast changes in your skin, they are signaling something deeper. Whenever you see a mole that changes, grows, itches, bleeds, or changes color, use the ABCDE rule. Asymmetry, border irregular, color variation, diameter, evolving. Skin cancer is most treatable when caught early, so don't put off a skin check. Reduce sugar intake. Hydrate. Check vitamins. Seek dermatologist for fast changes. Take photos of the spot from different angles and dates to show your clinician. If it bleeds or grows quickly, get an urgent appointment. Type M if you've checked your moles this year. If not, promise in the comments you'll check tonight. Sign number 7, persistent or recurrent fever. A one-off fever with a cold is common, but fevers that won't go away or keep recurring should be investigated. Chronic infections, autoimmune diseases, or even cancers can present with repeated fevers. Write down when fevers happen and how high they climb. Note other symptoms: weight loss, night sweats, rash. That helps your clinician find the cause. Have you had unexplained night sweats? Say yes or no, and how many nights? Sign number 8, frequent headaches. Frequent headaches are not normal, and they're not something you should ignore. They can be an early sign of high blood pressure, dehydration, stress, or poor sleep. Eye strain from screens can also trigger daily headaches. For some people, especially women, headaches may be linked to hormonal changes. And if you overuse painkillers, they can actually make headaches worse. But here's the scary part. Persistent or worsening headaches can sometimes signal serious conditions like stroke or brain infection. Drink plenty of water. Reduce screen time. Check your blood pressure regularly. Get medical help immediately if headaches are sudden, severe, wake you from sleep, or come with vision problems, weakness, or confusion. Your body speaks, don't ignore the signs. Do you get headaches often? Type yes or no in the comment. Sign number 9, persistent bloating. Feeling bloated all the time could be more than just food, it could be your body's early warning sign. Quick question: where are you watching from? Have you ever experienced bloating that just won't go away? Drop your city in the comments. If you feel bloated every day, your gut is not digesting properly. Frequent bloating is a major sign of poor gut health. Bloating happens to everyone sometimes, but if it's persistent, pay attention. It can signal digestive issues, conditions like irritable bowel syndrome, constipation, or small intestinal bacterial overgrowth can make your stomach swell regularly. These are often accompanied by other symptoms like gas, diarrhea, or stomach cramps. It could also be a sign of food intolerances. Sometimes it's not the quantity, but the type of food you eat. Lactose intolerance, gluten sensitivity, or other food sensitivities can trigger bloating that lasts hours or even days. It can also be as a result of fluid retention or hormonal changes. For some, bloating is linked to hormonal fluctuations, especially in women around their menstrual cycle. But if it's constant, it could point to problems like kidney or liver issues. Persistent bloating can also be an early warning sign of serious conditions like ovarian cysts, tumors, or other gastrointestinal disorders. The key is not to ignore bloating if it comes with other symptoms like unexplained weight loss, severe pain, or vomiting. It's important to recognize when bloating is more than just a temporary inconvenience. Watch for these signs. Bloating that lasts for weeks or keeps returning despite diet changes. Pain that's sharp, sudden, or severe. Changes in your bowel habits like constipation, vomiting, or diarrhea that won't resolve. Feeling full quickly or a noticeable swelling in your abdomen. If you notice any of these, it's time to consult a healthcare professional. Early detection is key. Sign number 10, dark or yellow urine. Have you noticed your urine looking darker than usual? Don't ignore it, it could be your body sending an urgent warning. Urine color can tell a lot about your health. Dark yellow or brownish urine isn't just about dehydration, it can signal liver or kidney problems. When your liver is struggling, excess bilirubin can build up, giving your urine a darker hue. Kidney issues can prevent proper filtering, which also changes the color. Sometimes, certain foods, supplements, or medications can cause temporary changes, but if the color persists, it's a red flag. Even mild dehydration can make your urine darker, so drinking enough water is important. But persistent changes could mean something more serious, like infections, liver disease, or other internal issues. Pay attention to accompanying symptoms like fatigue, swelling, or unusual pain. Your body rarely sends a warning for no reason. Catching problems early makes treatment easier and more effective. So don't ignore dark or unusually yellow urine, listen to your body. Next time you see your urine looking different, take note, stay hydrated, and consult a doctor if it doesn't improve. Your health is worth noticing every small change. Sign number 11, frequent thirst. Feeling thirsty all the time might seem harmless, but it can be a sign of something serious. One common cause is dehydration, but if you're drinking plenty of fluids and still feel parched, it could indicate high blood sugar levels. This is often linked to diabetes, a condition that affects millions worldwide. When blood sugar is too high, your kidneys try to get rid of the extra sugar by flushing it out through urine. This process pulls water from your body, leaving you feeling constantly thirsty. Alongside thirst, you might notice frequent urination, fatigue, or blurred vision. These are classic signs you shouldn't ignore. Another possibility is kidney problems. Your kidneys play a key role in balancing fluids. If they aren't working properly, your body may struggle to maintain hydration, leading to unrelenting thirst. Even certain hormonal imbalances or medications can trigger this symptom. That's why it's so important to pay attention. Frequent thirst isn't just a random annoyance, it's your body trying to tell you something is off. Ignoring it could delay the detection of a serious health issue. So next time you feel unusually thirsty, take a moment to listen to your body. Reduce sugar intake. Check your blood sugar, stay hydrated, and also consider speaking to a healthcare professional. Your health is too important to ignore small warning signs, they could be the first clues to a bigger problem. Sign number 12, trouble sleeping. Do you struggle to fall asleep? Or you fall asleep, but keep waking up at night? If this keeps happening, your body may be trying to warn you about something deeper. Many people think poor sleep is just stress or too much screen time. But when trouble sleeping becomes frequent, it can be an early health warning sign you should never ignore. Your body uses sleep to repair itself. During deep sleep, your brain resets, your hormones balance, and your heart and immune system recover. When sleep is constantly disturbed, this recovery process breaks down. Trouble sleeping can be linked to hormonal imbalance, especially high cortisol, the stress hormone. When cortisol stays high at night, your body remains in alert mode, making it hard to relax or stay asleep. Over time, this can lead to anxiety, weight gain, and exhaustion during the day. Poor sleep can also be a sign of blood sugar issues. Sudden drops in blood sugar during the night may wake you up feeling restless, sweaty, or hungry. This is common in people with insulin resistance or early diabetes. Another hidden cause is sleep apnea, where breathing briefly stops during sleep. Many people don't realize they have it, but signs include loud snoring, waking up tired, morning headaches, or feeling sleepy during the day even after a full night in bed. Long-term sleep problems can increase the risk of heart disease, depression, memory problems, and weakened immunity. That's why persistent sleep trouble should never be ignored. You can help yourself to sleep better by limiting night screens. Try magnesium tea instead of coffee. Relax before bed. But if you've been struggling with sleep for weeks, it's important to look beyond just going to bed earlier. Pay attention to your stress levels, diet, breathing during sleep, and overall health. Your body speaks through sleep. Sleep is when your body heals. Poor sleep weakens your immunity, digestion, and focus. Ignoring it could mean ignoring an early warning sign. Have you been sleeping well lately? Tell me in the comments how many hours you usually get each night. Sign number 13. Sudden weakness, numbness, trouble speaking, or slurred speech. Have you ever woken up and suddenly felt weakness in one arm? Or numbness on one side of your face? Or noticed your speech sounded strange or slurred? Many people brush this off and say, maybe I slept wrong, or I'm just tired. But this is one warning sign you should never ignore. New weakness, numbness, or slurred speech can be a sign that your brain is not getting enough blood or oxygen. This often happens during a stroke or a mini-stroke, also known as a TIA. And when it comes to the brain, time matters. If one side of your body suddenly feels weak, if your face feels droopy, if you can't raise both arms evenly, or if your words come out unclear even for a few minutes, this is not normal. Even if the symptoms disappear and you feel fine again, damage may already be happening inside the brain. What makes this even more dangerous is that strokes don't only happen to the elderly. Young adults, people with high blood pressure, diabetes, high cholesterol, stress, or even smokers are also at risk. In fact, many people who experience these symptoms delay seeking help, and that delay can lead to permanent disability or even death. Here's the rule to remember. Sudden changes in movement, feeling, or speech are always an emergency. If this ever happens to you or someone near you, do not wait. Do not take painkillers. Do not sleep it off. Call emergency services or go to the hospital immediately. Quick treatment can save your brain and your life. If you're watching this and you've ever experienced something like this, comment yes below. And tell me in the comments, what country are you watching from? This is one early health warning sign you should never ignore. Sign number 14, severe or persistent abdominal pain. While gas and mild cramps are common, intense pain, pain that localizes, like lower right for appendicitis, or pain with fever, vomiting, or blood in stool may indicate appendicitis, pancreatitis, bowel obstruction, peptic ulcer, or other emergencies. Note exact location, start time, what makes it better or worse. If pain is severe, go to emergency. If mild and persistent, make a GP appointment and record symptoms. Drop an emoji if you've ever had severe belly pain and say what fixed it, if anything. Sign number 15, unexplained bleeding or easy bruising, especially if it's new. This could be a blood clotting disorder, low platelets, liver disease, side effect of medications like blood thinners, or other issues. It's serious if bleeding won't stop, or you have blood in urine, stool, or vomit. If bleeding is heavy, seek emergency care. For mild unusual bruising, book urgent blood tests and stop any non-essential blood thinning meds only under a doctor's advice. If you take a blood thinning medicine, type the med name, example, aspirin. Quick recap. 1. Unexplained weight loss. 2. Breathlessness. 3. Chest discomfort. 4. Bowel/bladder changes. 5. Persistent fatigue. 6. Changing mole/skin lesion. 7. Recurrent fever. 8. Frequent headaches. 9. Persistent bloating. 10. Dark or yellow urine. 11. Frequent thirst. 12. Trouble sleeping. 13. Sudden weakness/slurred speech. 14. Severe abdominal pain. 15. Unexplained bleeding/bruising. If you experience any of these, take action. Which one surprised you most? Put the number in the comments, I'll respond. Here's a simple plan you can follow right now. 1. Make a symptom log, date, time, severity. 2. Take clear photos of visible changes, mole, bruises, swelling. 3. Call your GP and request blood tests if symptoms are unexplained. 4. If a red flag symptom appears, severe chest pain, fast stroke signs, severe breathlessness, heavy bleeding, call emergency services immediately. Promise me you'll do one thing in the next 24 hours, write which one you are going to do in the comments, example, book GP, check moles. I'll reply to a few. Thank you for watching. If this helped you even a little, hit like and subscribe, it helps this video reach people who might really need it. Share this with someone you care about. I'll be reading comments and answering questions for the next 48 hours. Tell me where you're watching from and which sign you want a deep dive on next. See you in the next video, stay safe.